This is a briefing, not a story. What you are about to see is not an investigation into a health crisis. It is a forensic analysis, a post-mortem of a catastrophic system failure. Our objective is not to find hope, it's to document the crash. The official file designation is national productivity attrition. That's the sanitized term for a nation losing its workforce. But the operational status is more accurate. Catastrophic system failure. A system-wide, unrecoverable error. The purpose of this briefing is threefold. Assess the total damage, identify the primary exploit, and document the system's terminal protocols. Let's begin. We begin with a primary damage assessment, $49.1 billion per year. Do not mistake this for a budget line item. This is the quantifiable fiscal leakage from a system hemorrhaging its most valuable asset, its own people. That number breaks down to a silent tax of nearly $1,300, levied against every man, woman, and child in the country, every single year. It's the cost of a war nobody declared. I will repeat this because it is the fundamental premise of this entire analysis. This is not about sympathy. It's about system integrity. We are not here to diagnose a sickness in the population. We are here to chart the blast radius of an economic weapon that has been successfully deployed against the state. This is a damage assessment. Period. Our first chapter concerns the payload itself. We're calling it the logic bomb. In cybersecurity, a logic bomb is a piece of malicious code hidden inside a legitimate system, designed to detonate under specific conditions. It lies dormant until triggered, then it causes maximum damage. In this case, the code is chemical, the system is the Canadian economy, and the damage is the structural liquidation of its prime age workforce. Let's dissect the damage report. $10 billion for criminal justice. That's the cost of trying to police a failing state. $13.4 billion for healthcare. That's the price of patching wounds on a system that is bleeding out from the inside. But those are secondary explosions. The primary detonation, the real target, is the largest figure on the board, $22.4 billion in lost productivity. That's where the bomb was aimed. Visually, the data is even more stark. Almost half, 46% of the entire economic burden is not the cost of policing the fallout or treating the afflicted. It's the ghost value of work that will now never be done. It's the contribution of citizens who have been permanently disconnected from the system. All other costs are just symptoms, the sound of the explosion. The primary objective of the attack was always to erase the workforce. In game design, when a character or weapon becomes too powerful, developers nerf it. They intentionally weaken its abilities to rebalance the game. What we are witnessing is a productivity nerf on a national scale. It's an attack designed to rebalance the entire Canadian economy downward by over $22 billion a year. It's a ghost in the machine, silently and methodically draining the country's potential. And this is who's being nerfed. This isn't random. It's targeted. The highest concentration of fatalities, the absolute bullseye of the attack, is the 30 to 39 age bracket. We're not talking about entry-level workers or people at the end of their careers. This is the peak-earning, peak-producing core of the entire economy. When you remove a worker at age 35, the system doesn't just lose a person. It loses 30 years of future productivity, innovation, and tax revenue. This is a targeted decapitation of the labor market. A source on the ground put it to me more bluntly. He said, "The economy is just a high scoreboard where half the players have disconnected." Think about that. We're all busy watching the markets, the GDP, the score, but we're ignoring the fact that the game itself is emptying out. The labor shortage isn't a mystery that needs solving. It's a direct symptom of this mass disconnection. Now, we move from the economic what to the chemical how. We're going to analyze the weapon itself. This isn't a simple poison. This is a sophisticated, evolving piece of malware. We've classified it as a zero-day exploit, an attack that targets a vulnerability the defenders don't even know exists. Only this time, the system being targeted is human biology itself. The threat is designated Benzo-Dope. It's not one drug. It's a toxic cocktail of multiple substances, and its primary design function isn't just to be lethal. It's designed to be evasive. It is specifically engineered to bypass naloxone, which is our system's primary firewall. It's the one emergency countermeasure we have to reverse an opioid overdose, and this compound was built to render it obsolete. And the bypass mechanism is lethally elegant. Step 1, naloxone is administered, and it does its job. It kicks the opioids off their receptors, and respiration is restored. The system appears to reboot. But step 2 is the trap.
The benzodiazepines in the compound attack a completely separate set of neural pathways, GABA receptors, inducing a profound sedation that naloxone cannot touch. The result is a biological zero-day. The person is breathing, but they are functionally gone, a ghost in their own shell, completely unresponsive. The firewall worked, but the system is still crashed. This exploit is proliferating at a terrifying rate. In early 2021, only about 20% of opioid samples contained this bypass agent. Within 2 years, that number has more than doubled, peaking at over 53%. This isn't a random mutation. This is evidence of a deliberate, strategic shift in the market. The malware is being updated and deployed faster than we can even analyze it, let alone develop a patch.
But the attack is multi-vector. It's not just the benzo bypass. In 65% of fatal opioid overdoses, stimulants like cocaine or methamphetamine are also present. This is the physiological equivalent of flooring the gas and the brake in a car at the same time. The opioids depress the respiratory system, trying to shut it down. The stimulants strain the cardiovascular system, trying to redline it. It's a chemical civil war inside the body, a formula designed for catastrophic, total system failure.
Which brings us to the system's most critical vulnerability. An internal flaw so profound that it allows the system's own defensive measures to be turned into weapons against it. We call this the arbitrage. In financial markets, arbitrage is profiting from price differences in the same asset. Here, it's how the system is being forced to finance its own destruction.
So, how does the arbitrage work? On one side, you have a government-issued asset, a safe supply hydromorphone pill. It has a known dosage, it's stable, and it's practically free. It's a low-yield, low-risk asset. But on the street, that government pill becomes currency. It's diverted and traded for a high-impact, high-risk liability, a dose of unregulated toxic fentanyl. The user trades their government asset for a street liability, and the dealer profits from the spread. The system designed to provide safety is creating the very currency used to purchase danger.
And this isn't anecdotal, it's a documented systemic failure. A 2025 inquiry in British Columbia confirmed significant diversion of these government assets. Over 60 pharmacies were flagged for exploiting the protocol. The report was blunt. Prescribed pharmaceuticals are now a primary form of currency on the street. The harm reduction protocol has a backdoor vulnerability, and it's been left wide open for exploitation.
And that backdoor feeds directly into the national supply chain. One law enforcement sprint, C-Rock, seized 46 kilograms of pure fentanyl. To put that in perspective, that's enough to kill millions of people. And what did they find right alongside it? Over 15,000 pills, many of them diverted pharmaceuticals. The safe assets and the toxic liabilities are not in separate markets. They are part of one integrated criminal ecosystem.
Faced with an unpatchable exploit and a compromised defense, the system administrators have initiated a new protocol. It's not a repair. It's not a reboot. It's a containment strategy. Let's call it the 2026 sunset. The objective, partitioning the failure. When a part of a computer's hard drive is corrupted beyond repair, you wall it off to protect the rest of the system. That's what's happening now. This is the decommissioning list. 10 provincially funded supervised consumption sites in Ontario slated for shutdown. In Toronto, in Hamilton, in Thunder Bay, a city with a mortality rate 5 times the provincial average. These aren't just closures. Think of each site as a network server. One by one, they're being taken offline, walled off, and isolated from the rest of the system.
Now, the official messaging talks about community safety and a focus on recovery, but the operational reality is much simpler. Error isolation. When a segment of a network is so hopelessly corrupted that it threatens the stability of the entire system, you don't try to fix it. You disconnect it. You amputate the limb to save the body. This is a strategic retreat, not an advance.
The outgoing system, the supervised consumption sites, was a low-barrier safety net. Anyone could access it. The incoming system, the so-called heart hubs, is a high-barrier, abstinence-based model. It offers treatment, but with one critical function deliberately removed: no supervised consumption. In simple terms, the barrier to entry has been raised. The safety net has been cut.
And this raises the central, chilling question of this new protocol. Is the true objective to save the users, or is it to isolate the corrupted data, the users themselves, so that the core economy can attempt to function without them? Is this a rescue operation, or is it just damage control?
This brings us to the final analysis. The verdict. The system logs have been reviewed, the data has been cross-referenced, and all indicators point to only one conclusion: an unrecoverable error. Here is the final, fatal variable: the kill switch. The environment. For all the public debate and focus on public spaces, the data is unambiguous. 54% of all fatal system crashes, more than half, occur in private residences, alone, behind closed doors. This is the variable that voids every other countermeasure. Let's go back to our gaming analogy. This is the solo player meta. The system's main emergency patch, naloxone, requires a second player to administer it. When the toxicity event happens in isolation, there is no one there to deploy the patch. A temporary error becomes a permanent one. A recoverable state becomes a fatal system crash. Game over. So we return to our initial assessment, now with the full weight of the evidence. This was never just a health crisis. We are watching the structural liquidation of the Canadian labor force in real time. A slow, systemic culling of the nation's most productive demographic, executed with a chemical logic bomb and fueled by the system's own protocols.
The evidence is conclusive. The system isn't being repaired, it's being decommissioned, sector by sector. The new protocols are not about recovery, they're about containment and managed decline. So the question is no longer how to fix this broken system. The real question is, what do we build in its place? End of briefing.